Welcome, my name is Peter Strong. I'm a professional psychotherapist and I offer online therapy for anxiety and depression, addictions, and also for the treatment of OCD. So, obsessive-compulsive disorder really describes a problem of reactive, intrusive thoughts that just keep appearing in the mind and that trigger compulsive behaviors. Now, how do we manage these intrusive thoughts? Well, there are certain things you must understand. The first is that you cannot remove intrusive thoughts by willpower. If you try to stop those intrusive thoughts, you will actually end up making them stronger, because the effort to stop the thoughts is based on fear. It's a fear-based reaction. And any kind of reaction that's fear-based will have the effect of strengthening the emotional or cognitive habit that is already there. So we have to develop a different way of working with intrusive thoughts than trying to get rid of them or remove them, or even trying to distract ourselves away from them. Avoidance is also going to be primarily fear-based, and that will simply feed those intrusive thoughts. So we must take a different approach, and the approach that I teach involves mindfulness training. So mindfulness therapy teaches you how to change your relationship to those intrusive thoughts from one of fear and anger, which is also fear-based, to one of equanimity, of allowing the thought to be there without reacting to it, and also friendliness. This is an essential part of mindfulness training. We learn to make friends with those intrusive thoughts, even if they are negative thoughts or painful thoughts. The most important thing is to develop a non-reactive relationship with those thoughts, and that will involve developing a friendliness based relationship with the thoughts. Friendliness is non-reactive and it's not fear-based. So this will essentially take away the fuel that feeds those intrusive thoughts. Intrusive thoughts become intrusive because of the emotional charge that they have. It's not the thought itself that's the problem. It's the emotional charge that the thought has. And this is what keeps it coming back. We need to find a way to diffuse that emotional charge. And the first way is not to feed the emotion. So that's the reason why we focus on developing a friendly, non-reactive relationship with those intrusive thoughts and memories also. Now, it is not sufficient to just let them be there and hope that they will go away by themselves. That is not quite enough. Thoughts will go away by themselves, but we want to help them go away. In other words, we have to train with the thoughts to help them resolve themselves. And one of the best ways to do this is to look at the imagery of the thoughts and then change that imagery. So, intrusive thoughts have a high emotional charge, and that is maintained by their internal imagery. So those thoughts typically will look large, they will be high in your visual field, and often they will have an intense color as well. This imagery is what keeps that emotional charge alive, and that's what keeps the thoughts in an intrusive and repetitive manner in the mind. So when we can start to develop a friendly and conscious, a mindful relationship with the thoughts, then we can begin to explore this imagery. We get to see the imagery. If you react to the intrusive thoughts, then you won't see anything. You will just experience the reaction and the fear. But if you have a non-reactive relationship, then you get to see more, and you will get to see how this imagery works. When you identify aspects of that imagery, then you can begin to bring in the element of choice. You can start to change that imagery, and this is what's involved in training the thoughts to resolve themselves faster. The reason they don't resolve is because that imagery can't change. It's an unconscious, habitual part of the structure of the thought. But when you bring mindfulness to it, you see the imagery clearly, and then you can begin to help it change. So this is really helping the thought resolve itself. And when it changes its imagery, it loses that emotional charge, and then it will disappear. So this is what's involved in training with our intrusive, obsessive and compulsive thoughts. We look at the imagery and we start changing it. Very typically, this will involve making the thoughts very small. The smaller they are, the less emotional charge. It will involve changing their position. Typically, intrusive thoughts are at a high level. That is, they are at the level of the head. They're inside the head or buzzing around the head like a swarm of bees. That's part of their imagery. If you change the position and put those thoughts on the ground, that can significantly reduce the emotional intensity, the charge of the thought, and that will help it resolve. So if you train the thoughts to move their position to the ground, you will help neutralize the intrusive nature of those thoughts. Changing its color is also a very interesting thing to explore. Typically, intrusive thoughts will have a very vivid color, usually a bright color, perhaps red or orange or black. If you change the color, you will change the emotional charge of that thought. So we explore changing color. So there are lots of things we can do along these lines. The most important thing, though, is that you have to first establish that non-reactive relationship so you can see the thoughts very clearly and then start to train with them and teach them how to resolve themselves. From my experience with working with people who suffer from obsessive-compulsive disorder and intrusive memories and thoughts, including traumatic memories, I find that this mindfulness therapy approach to be the best approach that I have ever explored with people. It's very, very effective. So if you'd like to learn more about the mindfulness approach, then please email me. So medications are often prescribed for OCD to reduce the intensity of the anxiety, but I think you'll understand that's just treating the symptoms. It's not treating the underlying process that creates those intrusive thoughts. It's not changing the imagery. So if you would like to learn more about how to treat OCD without using medications, but through this mindfulness-based approach, do please contact me. Most people see quite dramatic changes within a matter of a few weeks once you start applying these mindfulness methods, and this will include meditation, but a different kind of meditation than you may be familiar with, because when I talk about mindfulness meditation, I'm talking about meditating on the mind. So in this case, we would actually learn to meditate on those intrusive thoughts. We would deliberately bring them into the mind and start building this non-reactive relationship and start exploring how to change the imagery of those thoughts. So this is training, active, focused training to help those thoughts resolve themselves and lose their emotional charge so they no longer become a problem. Generally, when you can do that with the thoughts, then the compulsive behaviors will also subside, because there is nothing that is connected to the behaviors. There's nothing that can feed the compulsive behaviors. So, if you'd like to learn more and you'd like to schedule some online therapy sessions with me, then please contact me. Thank you.